The genus Vibrio contains gram-negative facultative anaerobes that are oxidase positive. Remember, when we're talking about gram-negative organisms, those Enterobacteriaceae are going to be oxidase negative, but a lot of the other gram-negatives will be oxidase positive. So because they are facultative anaerobes, they can also do some fermentation. They are pretty motile because they have polar flagella. They are most commonly found in water, especially salt water, and they cause gastrointestinal infections and flesh-eating infections. And the three major species that we'll talk about are Vibrio cholerae, Vibrio parahemolyticus, and Vibrio vulnificus. Under the microscope, they're going to be slightly curved or comma-shaped, and again, they'll have that single polar flagellum to help them move. They have a pretty varied temperature range at which they'll grow, anywhere from 14 to 40 degrees. And as I mentioned previously, they do require salt for growth. As a gastrointestinal pathogen, one of the challenges for Vibrio is that they do have to pass through the stomach, which is highly, highly acidic. And they are very susceptible to stomach acid. There are a couple of different mechanisms by which the Vibrio are able to deal with the stomach acid. And so I would like you to look that up. And in your reflection, include a couple of different ways that the gastrointestinal Vibrio are able to tolerate stomach acid in order to cause a GI infection. Again, the majority of species and strains of Vibrio will have polar flagella. They also have pili for attachment that can allow for increased virulence. In Vibrio cholerae, we do have a toxin co-regulated pilus, and I'll talk about why the toxin is important, but that pilus helps them to attach even better. The three species are listed here again, but also included here are the source of the infection and the type of clinical disease you can see. Vibrio cholerae is associated with water or food that's been contaminated and causes gastrointestinal disease, and can go systemic to cause bacteremia. Vibrio parahemolyticus is found in shellfish and water, and also can cause gastroenteritis, but also can cause wound infection. And then Vibrio vulnificus, found in shellfish and seawater, is more associated with wound infection rather than any type of GI condition. Because they are gram-negative, as you may suspect, they do have LPS, and the O antigen of the LPS is used to classify them into serogroups. Many strains have a polysaccharide capsule, which again can help with immune evasion, with the major exception of Vibrio cholerae strain O1. And kind of unique among the bacteria, they have two chromosomes. So rather than a single chromosome, Vibrio have two. They also, some strains may contain plasmids that have genes conferring antibiotic resistance. The different species of Vibrio, again, are listed here, this time with their virulence factors and the biological effects of those virulence factors. I'm not going to read through this list right now. As we talk about the different species, we'll talk about some of those various virulence factors and how they help that species specifically cause disease. Vibrio cholerae is the bacterial agent that causes cholera. Cholera is mediated by cholera toxin, which, as many of the toxins we've talked about already, is an AB toxin. It has 5 binding subunits and a single A subunit or active subunit. When the A subunit is internalized into host cells, it leads to significantly increased formation of cyclic AMP. That increase of cyclic AMP leads the cell to expel a large amount of water and electrolytes. And so that's the major symptom is going to be diarrhea. When you have intestinal cells leaking water, that water has to go somewhere. If the bacteria are not able to adhere, there is no infection. So if you happen to ingest the bacterium but they don't stick to the intestines, you're going to be fine. And while cholera toxin itself mediates some of the major symptoms of the disease, including liters of diarrhea per day, strains of Vibrio cholera that do not produce the toxin still do have other toxins that can lead to a more mild diarrheal disease. The two strains that produce cholera toxin are the O1 strain and the O139 strain. And the most recent pandemic of cholera, kind of the one that's still ongoing a little bit, is a particular biotype called L-Tor, and it is part of the O1 strain. In general, these bacteria, but also kind of specifically for cholera, they grow in marine environments and estuaries. So salty, they don't have to be terribly salty. They can grow in low levels of salt as well. They will do much better when the water's warmer, and they also can be found in shellfish. So when you're thinking of shellfish are often filter feeders, and so the bacteria kind of accumulate within these shellfish, especially things like mussels and clams and oysters. They can have a really, really high load of these bacteria. So they spread through contaminated food and water. It generally requires a very high inoculum in order to establish an infection. Remember, I said they're super sensitive to stomach acid. So a high inoculum is one of the ways that they can get around being destroyed by stomach acid. If you ingest enough of them, while the majority might be destroyed by the stomach acid, some of them might sneak through. But there are other ways that they can cause infection, even with that really low pH of the stomach. We generally see cholera epidemics in areas of poor sanitation because the bacterium is transmitted through the fecal-oral route. So especially in areas where people bathe and drink from the same water source, that's where we see that. So for clinical disease, cholera, the disease cholera is caused by Vibrio cholerae. Remember those two strains, O1 and O139. Abrupt onset of watery diarrhea and vomiting can progress to severe dehydration, and that's what kills patients, is they die of dehydration within a couple of days. For strains that do not produce the cholera toxin, it'll be a milder form of disease, but still it'll be a diarrheal infection. Vibrio parahemolyticus, again, gastroenteritis, generally self-limited with explosive onset of watery diarrhea, nausea, vomiting, cramping, headache, low-grade fever. Basically what you would expect if you had a GI infection. The wound infection is usually associated with exposure to contaminated water. So if you happen to get into a warm, salty body of water and you have a wound on your skin, that can allow the bacteria to get in. Same thing with Vibrio vulnificus. However, the wound infections caused by vulnificus are usually far more severe than those caused by parahemolyticus. These can be fatal infections. You'll have redness, right, the erythema, pain, that kind of like bubbling, right? Remember that we saw with like staph, tissue necrosis, and septicemia. So when patients have cholera, what I'm trying to show you here is what is done when patients have cholera. So when patients have cholera, these are called cholera cots. And the patient is laid down on the cot. You can imagine what part of the body goes here. And as they are passing the diarrhea, that volume of fluid is collected and measured, because the only real treatment for cholera is oral rehydration therapy. So what clinicians, healthcare workers will try to do in this situation is replace as much of the fluid as is lost as possible. So it's important to measure out how much fluid is lost. And this is what the stool looks like. They call it rice water stool because it pretty much, I mean, there's nothing solid in there. It's clear, but it's full of the microorganism. So there was an outbreak of cholera in Yemen a few years ago, more than 500,000 people. And again, this is a patient receiving the oral rehydration therapy. Generally, if you can survive the 2, 3, 4 days of fluid loss, you're going to be fine. You're going to recover. With children, you can see this is a child. With children, it's more dangerous because they tend to dehydrate much more quickly. So for an otherwise healthy adult, it's a lot easier to recover. But with children, you have to really be on top of the infection and that rehydration therapy. So that's what's happening here. With Vibrio vulnificus, we do see these infections in the US, especially along the Gulf of Mexico. So 6th case of Vibrio in Mobile County in Alabama. Florida resident catches deadly ocean-borne bacteria. This one was outside of Galveston, which again is on the Gulf of Mexico. A flesh-eating bacteria infected his new tattoo. So he had recently gotten this tattoo and the bacteria got into the wounds. As you hopefully are well aware, a tattoo is just a big giant wound. And so he went swimming in the Gulf of Mexico and unfortunately died of a Vibrio vulnificus infection. So flesh-eating bacteria kills Virginia resident. Public health, this is King County, which is Seattle. A rare, sometimes fatal bacterial infection was found in fish from live tanks at a local store. So, anyone who comes into contact with raw fish should seek medical care. Nueces County is Corpus Christi, Texas. Vibrio death shows why you should always beware of raw oysters. So, like I told you, these will really concentrate within these shellfish. Vibrio outbreak linked to crab meat imported from Venezuela. So the water off Venezuela is warm. So all of these places that have warm water, you are looking at the risk of these infections. And I don't want it to, we talk about areas of poor sanitation, and the US has great sanitation for the water, and I don't want you to think that it's not possible to get these infections in the US. It is possible to see them, especially Vibrio vulnificus is found in high numbers off the coast, off the Gulf Coast. So, Texas, Louisiana, Mississippi, Alabama, Georgia, Florida, all along in there. And when I was doing my PhD, the lab next door actually worked on cholera, and they would periodically, we were in San Antonio, so they would periodically go down to the Rio Grande, which is a river that forms the border between the US and Mexico, and they could always isolate cholera from that river. So it is a bacterium that's in the US. Vibrio vulnificus is a bacterium that's in the US, and so these are possible infections that you could see in a clinical setting. And again, they're not rare. These data are a little bit older, but you see, we don't get a lot of cholera in the US. That tends to be generally more in other countries, but total cases of Vibrio over 1,200. Vibrio parahemolyticus and Vibrio vulnificus combined, right? And then up here would be the total. So you get a lot of Vibrio in the US. It is not rare. And one of the other things to think about as we think about how the climate changes, if we think about rising ocean temperatures, these bacteria can spread to regions where perhaps they hadn't been common before. So the flesh-eating bacteria infecting more people and spreading to new areas. Scientists blame climate change. The bacteria are sensitive to drying and acidity. If you're going to do culture, you should do it rapidly and on appropriate media. But usually for patients who have diarrhea, so any of the gastrointestinal infections, antibiotic therapy is usually not prescribed because the patient, if they survive the initial dehydration, will generally clear the infection within a few days. Of course, for patients who have wound infections, yes, antibiotics, and very, very quickly. So for patients who have the diarrhea or gastrointestinal infection, fluid replacement therapy is really going to be the best. And remember, not just water, you want to have electrolytes in there as well. For Vibrio vulnificus, that's the one where we'll see the higher levels of antibiotic resistance. So we definitely would want to have our patients being prescribed combination antibiotic therapy to really help clear that infection. Once it gets in, it can spread rapidly and cause septicemia, leading to the patient's death. There is an oral cholera vaccine available in other countries. The efficacy is debatable, but if you were planning to go to an area where cholera is endemic, maybe it would be something you would consider. But definitely if you were planning to live for any extended period of time in an area where cholera is endemic, you would definitely want to consider that. In other cases, you just want to make sure that you drink bottled water or boiled water so that you know that your water is safe and free from the Vibrio bacterium.